Another study was a non-randomized comparison cohort or quasi-experimental study by Park 2014. The purpose of this study was to determine the effect of a silicone border foam dressing on the development of pressure ulcers, and they also looked at incontinence-associated dermatitis in the intensive care unit patients. The sample and setting occurred in the ICUs at Samsung Medical Center in South Korea. The participants, the N was 102, which was appropriate for this study. The independent variable here was the application of the silicone border foam dressing to prevent pressure ulcers and IADs. The dependent variable was again to decrease or see if it decreased incidence of pressure ulcer and IAD. They used the Braden scale to help measure and rank and to see what the severity of pressure ulcers were. They also found some very significant findings. They found that the application of a silicone border foam dressing decreased pressure ulcers, the development of them, and reduced the IADS score. As the rates of the IADS increased, so did the rates of the pressure ulcers. They found there was a strong correlation between the two that further needs to be studied. This was level 4 evidence. I ranked this as medium evidence. And for my evidence in this study and all of the studies that I placed in my table here, I utilized the critical appraisal series. The step-by-step, I used article number 1, and it was great to help me really visually see what level of evidence I had and place it in a rank, give it a score basically. Overall, I found that this study quality was medium due to the lack of randomization and small sample size. Although it was appropriate to the stated population, further study is needed.